And you know, diabetes isn't just one single thing. There are actually three main types. You've got type 1, which usually shows up when people are young, and they need insulin to manage it. Then there's type 2, that's the most common one by far, and it's heavily tied to our lifestyle, which also means it's often preventable. And finally, there's gestational diabetes, which can pop up during pregnancy.
Okay, so knowing all this brings us to a really important part, the risks and warning signs. And listen, we have to be straight about this. The risks are serious. Think about it. That extra sugar floating around in your blood, it's almost like a poison for your blood vessels. Over time, that damage can lead to some really scary stuff. Heart attacks, strokes, losing your vision, kidney problems, and really painful nerve damage, especially in your feet.
There's a quote from one of our sources that just hits you right in the gut. It says, "Many discover they have diabetes only after these problems occur." Just think about that. People are finding out they have it because they're already having a major health crisis. That's why being proactive is so key. But your body does try to send out some warning signs. You might notice you're running to the bathroom all the time, or you're just constantly thirsty or hungry. Maybe you feel wiped out, completely fatigued for no reason. Some people even lose weight without trying. And a big one is noticing that cuts or scrapes take forever to heal.
But here's the most crucial point of this whole section. A lot of people have no early symptoms. None. Zilch. That's why you just can't wait until you feel sick. Getting a regular checkup, especially after you turn 30, is just so important.
Okay, let's shift gears now to the best part of this whole story, the empowering part. Because when it comes to type 2 diabetes, prevention is in your hands. And you might be thinking, oh no, this is going to be some huge, impossible lifestyle change. But get this, the science is amazing on this. Just look at this number, 5 to 7%. That's it. Research shows that losing just 5 to 7% of your body weight can slash your risk of getting diabetes. That's not a mountain to climb, it's a hill. It's totally doable. And how do you do it? With simple steps you can start today. We're talking about a brisk walk, 30 minutes, 5 days a week. Maybe cutting back on things like white rice and all those processed foods and packets. And for sure, ditching the sugary drinks. Instead, pile on the veggies and lentils. It's not about being perfect, it's about making small, smart choices consistently. Okay, and finally, for anyone listening who already has a diagnosis, let's talk about what comes next. Let's talk about living well with diabetes. First things first, please don't be afraid. Getting diagnosed is not the end of the world. It's really not. With the right plan and the right care, you can live a completely normal, full life. It's 100% possible. So what does that plan look like? Well, it's built on a few key pillars. First, diet and exercise. Those are your foundation. Then there's medication.